when multiple different strains infect one person, you can get a progeny strain, a baby strain, that's a mixture of all of them. This swine flu that's coming out right now is a mixture of 2 different types of pig flu and human genes, and so it's a very unique, different type of flu that's out there now.
So is it easy for humans to get infected with this kind of flu?
As opposed to the avian influenza that we've seen coming out in parts of the world, this appears to be more easily infected to people. And in fact, we've seen outbreaks of swine flu before. In 1976, in Fort Dix, there was an outbreak among soldiers, and this resulted in a big vaccination campaign. We did not have a major outbreak then. Certainly the 1918 swine flu resulted in a large epidemic around the world. It's way too early right now to tell what's going to happen with this one.
How is this one spread so easily?
All influenza is spread in respiratory secretions, at least in people. So if you cough, if you get it on your hands, you shake hands, and then somebody wipes their nose or their mouth, it can be spread that way.
So it's similar to any other kind of flu?
Swine flu and regular flu are the same, really.
What are the real dangers here in terms of, from what we know, there have been people in Mexico who have died. No one has died yet in the United States. Is it an issue of healthcare systems being better than the other?
And the answer to that, Marsha, is no one really knows. The CDC from Atlanta is looking into this right now. We're trying to figure out why there's such a large death toll in Mexico. The other thing is we have no idea how many cases there are in Mexico. This may be the tip of the iceberg. There may be thousands of cases with a small number of deaths. In the United States, of the 40 cases we have so far, I believe it's up to 40, we have 1 person that's been hospitalized. And that's it. Everybody else has had very minor illnesses and are going home.
At this point, the president is suggesting that there is an emergency here now. Would you agree with that at this point?
I think the point is this is a strain that we have not seen before. The combination of genes in this virus is different than the CDC has ever seen before. We don't have any effective vaccines against this at the present time, so the only thing we're left with is antiviral therapy with Tamiflu or Relenza, which are the 2 drugs against it. And we have limited supplies in this country. So this became a major outbreak, and especially affecting the frail elderly or younger children. It could be a major problem.
One thing we want to know, I know you've been in discussion about this issue since Friday, and the one thing we want people to understand is that you cannot get it from eating pork. I know you're getting all kinds of questions about this situation.
Certain foreign countries have asked that we not send our people over there and travel. So they're saying if you're traveling from the United States or Mexico, don't come.
Oh.
And I believe that it's been China and at least one other country that's banned imports of pork from the U.S.
Okay.
This is transmitted in respiratory secretions, not in food. It is not a foodborne illness, and there are no risks at all.
And one last thing for people to listen and think about, the symptoms. Are they similar to any other kind of flu?
Swine flu symptoms, and at least the ones that the Centers for Disease Control has put out on their website, are exactly the same as regular flu. Aches, pains, runny nose, sore throat, feeling like you've been hit by a truck. And if you have this, I mean, this is really very similar to any other virus. If you are concerned, please be evaluated by your doctor. But again, there's not a major problem insofar as getting tested because most people will not have this.
All right. Thanks so much, Dr. Bernstein. And so we will keep you on hand for any further developments, that's for sure. As the swine flu quickly spreads across the border, so does the news of the pain that's already causing.
As the swine flu quickly spreads across borders, so does the news of the pain it's already causing.
I'm worried because I never hear something like that in my life.
Adriana Sanchez says she knows of the scores of people in Mexico already dead from the virus and the thousands of others living in fear.
Schools, daycares are closed, church too.
Even the country's favorite sport, soccer, is being held in front of thousands of empty seats.
So I hear that some of the teams, they gonna play, but with no people. It's gonna be closed door because, you know, the flu. So they say they lose millions.
But here at the La Favorita Market on 3rd Street in Dayton, the flu still feels far off in many ways. Adriana says she doesn't personally know anyone affected, and many others we talked to around town said the same thing.
You know, people keeping working, never see TV, so that's why they don't know.
So for now, the virus's impact is showing up in the small things, like a canceled trip back home.
My cousin from Chicago, he had plans to go Mexico in July, but he said he don't go.
Jordan Burgess, 2 News on your side.
And now still ahead, we have continued team coverage at 5:30. We'll hear from the Public Health of Dayton Montgomery County, as well as check in on how Clark County is preventing swine flu. And of course, we're on your side with the comprehensive action plan at WDTN.com. We'll find the links to the CDC, the Ohio Department of Health, and the Agriculture Department. Anything you need to know to protect your family. Click on the web links tab under On Air for more information. Also, here is a hotline number, 1-866-800-1404.